A very warm welcome to all the panelists and the participants who've joined the session and who are watching the session live on our social media platforms. Now, we would quickly come over to the topic of our discussion, which is improving operational efficiency through digital health. This is the most talked of subject matter in today's healthcare scenario. Now, as we all know, hospitals drive the health of a nation. Their operational efficiency thereby plays a vital role in deriving favorable patient outcomes. Digital health is one of the tools that has the capability of improving efficiency of healthcare organizations. Digital health is also currently a high priority area for the Government of India. While private players have been rooting for this cause for a while, it is only after the pandemic that digital health has taken a leap in India. In today's discussion, we shall talk more about the various ways in which digital health can be leveraged to improve operational efficiency in the healthcare ecosystem. Now, let me take this opportunity to introduce you to our eminent panelists of our session. It's an honor to introduce my first panelist, Dr. S. Manivanan, founder and managing director, Kaveri Group of Hospitals, founder of Medicall, India's largest medical equipment exhibition, founder and director, Agile Health, a leading healthcare ERP solution. He aims towards healthcare affordability. His leadership leads and provides healthcare's mission, vision, values-based treatment to patients. He aims towards deploying digital strategic thinking. He is passionate about data analysis and providing top-notch patient care with assured quality. He is a certified assessor in NABH, Lean Six Sigma champion, a passionate about information technology and healthcare analytics, past chairman of Roundtable India, past district secretary of Indian Society of Anesthesiologists in Trichy City branch. A warm welcome to you, sir.
Thank you.
Moving on to our next speaker, Ms. Ruma Banerjee, Vice President, Neotia Healthcare Initiative, Ambuja Neotia Group, Kolkata. Ruma Banerjee leads the projects and business operations of the healthcare vertical as the Vice President of Neotia Healthcare Initiative Limited. She started her career with Bhagirathi Neotia Women and Child Care Center, Kolkata, in the year 2001, after completion of a post-graduation in hospital management as Junior Executive Operations. She was quickly selected by the management to head the administration of the flagship hospital. She was assigned with the responsibility of setting up Genome, the fertility center, in the year 2006, which at present has 6 centers spread across West Bengal and Chhattisgarh. She was also involved in setting up Neotia Mediplus Clinic, Garia, in the year 2010 and Neotia Academy of Nursing in the year 2011. The group launched Neotia Getwell Healthcare Center in Siliguri, the 250-bed multi-super specialty hospital in the year 2012, and second Bhagirathi Neotia Women and Care Child Center Hospital in Newtown in the year 2018 under her able leadership. A very warm welcome to you, ma'am. Our next eminent panelist of the session, Mr. Abhishek Kapoor, Executive Director, Regency Healthcare. He completed his undergraduate from Simon Fraser University, Vancouver, majoring in finance and human resource. Post which, Abhishek worked with PricewaterhouseCoopers, Ernst & Young, American Appraisal, and Deloitte with the strategy consulting and merger acquisition valuation practice. To hone his managerial skills, he went on to get his MBA from the prestigious Kellogg School of Management, Northwestern University, Chicago. Post his MBA, he worked at DaVita, the largest kidney dialysis chain in the US, before returning to Kanpur to assist Regency in expanding and achieving its vision. Under him, Regency has grown to 7 facilities, and he has been instrumental in securing funding for the group to cater to the group's expansion requirements. A very warm welcome to you, sir. Now, moving on with the topic. To start with the doctor in the panel. We all would like to know whether digital health has really added value to the doctors to achieve efficiency in their job, and if so, how? Also, if you can share some instances about the challenges that you might have faced as a doctor in the implementation of digitization. Over to you, Dr. Manivanan.
Yeah, the digital health is something uh, which was talked about a lot in the last 2 years, actually. And sometimes I feel that there's too much of hype on digital health, actually. A lot of startups are there and getting a lot of fundings and other things. But my personal experience is we started our hospital in 1999 in the tier 2 town, my native town. When we started, I saw my first computer actually. Before that, I haven't seen a computer at all. I mean, probably I've seen a computer in railway booking counter. After that, I haven't seen a computer. So after that, over a period of time, while implementing various ERP systems and other things, I learned a lot of things by making mistakes. Of course, since other people are busy with other jobs, I was jobless. I was made to look into IT. So that's how I learned all those things. And I realized that such an important technology, which people are not using actually. If you talk to a doctor, what do you mean by technology? Actually, a lot of hospitals proclaim that world-class technology. World-class technology means they think that having a 365 say, CT or 3 Tesla MRI or latest flat panel cath lab is great technology. Those technology are all easy to buy, easy to maintain, and easy to replicate. Actually, people don't think that ERP systems or other patient engagement platforms as or investing in an EMR is they don't think that that's technology. Actually, unfortunately, that's one biggest reason why healthcare IT has not picked up well in India. Actually, say if you go and sell a CT scan or MRI, Mr. Shravan will easily sell for 5 crores or 10 crores, actually, easily, actually. Whereas if you ask some IT guy to go and sell a EMR for 1 crore, none of them would have sold for 1 crore, actually. Okay. So that's a sad part. Because doctors are used to technology, these technologies, right from undergraduate or postgraduate age. They are not exposed to the other kind of technologies, actually. So I feel that, say, if the doctor, since you asked a specific question, I'm talking about doctor, non-medically, there are a lot of things. If you see that the doctor today is very stretched out by want of time, and there are a lot of other aspects in practice like litigation or patient stickiness or so many other things. Unless he gets the right data at the right point of time, it's very difficult for the doctor to deliver the personalized right care to the patients, actually. For example, I can say that suppose the patient doctor is seeing a patient in the OPD. If he doesn't have access to the latest lab reports or previous consultation reports or radiology reports in his hand as a doctor's workbench, the diagnosis could take a longer time, actually. Or a doctor who has got access to the critical values through his mobile app or whatever maze of digital options, then the decision making becomes faster. So a lot of new companies are coming up with digital ICUs and other things, which will enable the doctor to be in touch with their critically ill patients round the clock, whenever needed or whenever needed. Digital medium ensures that the doctor is provided with right information at appropriate or right time, actually. Okay. This helps in the decision making. And sometimes, of course, the biggest allegation against digitization is because of digitization, the doctors or nurses are all typing, sitting and typing. They are not looking at the patient, actually. So that's a problem with the technologists. And all the IT guys who have developed the EMR or all those things, they have made it so user friendly, user unfriendly. These doctors sit and type all those things and they don't see the patient's face, actually. If you could write UI, UX, and probably you can give technology to the doctors who will definitely use it, actually. And probably as administrators or senior people, we need to ensure that we educate our doctors on the importance of using technology, not the CT scan or MRI, using HR, all those HIS applications or digital ICUs or so many things. I'm sure that the doctor who has most of the time being the top in the university or college or school will be able to learn this technology faster.
Yeah, that was a great insight. Moving on to Ms. Banerjee, New Tier Healthcare has got a presence in both Tier 1 and Tier 2 cities. So, which is really challenging for the administration perspective to manage both the Tier 1 and Tier 2 cities at the same time. So what has been the acceptability level and the challenges that are being faced in implementation of digital health when catering in a metro as well as a non-metro city?
Oh, thank you so much, Momita, and happy to be here. Uh, you have very correctly said that we are placed both in a metro city and in a tier two town. Digital health typically is a new thing in the entire, healthcare delivery system. It's not very old. Essentially, the last 2 years of COVID pandemic have actually, moved our focus from the traditional way of functioning to a more towards more on a digital health platform. If you're asking the challenges which we typically feel, if you typically look at the efficiency which has now come on the digital health, like starting from the ambulatory care services, we are in a situation where the patient can, sitting at their home, book and schedule an appointment, even get a consultation done, get the report at their home, which actually makes it more accessible. It becomes more efficient at the hospital. You can utilize the outpatient system more optimal. But if when I typically work in a tier two town where the understanding of the people is there the acceptability is far behind, I would say. There still the people would love to come to the hospital and meet their doctors. We find it extremely difficult to tell them to get a diagnostic test report, you won't have to come to the hospital. It's actually available on your palm top.
Yeah.
But that's a problem. That's an awareness problem. It's as I said, it's a very new thing in the entire healthcare delivery system. Over a period of time, I'm sure as we have learned to order food from Zomato and buy movie tickets from Book My Show, I'm sure we also will learn to use digital health platforms, digital health services more and more in the system. And which Dr. Manivanan was very correctly saying, nowadays, there is a definite complaint that, doctors and nurses, they do not look at the patient, that they keep on typing on if it's EMR. That's probably one of the major reasons why EMR in India is not very, very, common. And we are moving in that particular space pretty slow. But off led, just to share here, I was just going through one of the providers in the health tech space. They have actually come up with a good option of voice recognition. The previous ones which I was seeing, the doctor was saying one and the recognition was something completely different. But typically in this one, I found it's a bit good. So this essentially says that, we are moving towards the requirement. The people who are working on this space are actually trying to, solve the problem which we face on a day-to-day basis. So if you typically talk about the challenges, I will say there has to be more awareness. The people will have to understand that it's not always you will have to go to the clinic or to the hospital to get the entire service of healthcare. It took time for people probably to accept ATM, that you won't have to go to the bank to draw money. There's ATM available.
Right.
So over a period of time, I'm sure I'm pretty positive that we will be able to achieve a better situation even in a tier two town.
Right. Thank you so much. Now I would move on to Mr. Kapoor. Mr. Kapoor, this would be a little from the other perspective, from the patient perspective. So from the patient perspective, what has been the readiness and the acceptance level if we talk about digital health? And if you can share some of the challenges or your experience that you might have faced as an administrator and as in from the operation level, and your thoughts on how to overcome them and to achieve patient satisfaction.
Thank you, Mamita. So, am I audible?
Yes.
I guess.
Yes.
So perfect. So, like Dr. Maniman said that, digital health has been more of a hype in the last few years, and it's a buzzword. So many health tech startups are coming around it. But, believe it or not, it's going to take over the way doctors deliver care. It's going to take over the way patients access healthcare, and it's going to deliver the way hospitals function. So, digital health is going to impact us in 3 ways, and the sooner we accept it, it is better. From a doctor's perspective, right? I mean, Dr. Ruma, Mr. Ruma Banerjee just spoke about how the innovations doctors have, and we all know doctors don't want to use EMR because they see that it's a sort of a punishment posting, that if we tell them that you have to use an EMR.
Precisely.
So, and some doctors are realizing now that they are not realizing the value of data, and they're not realizing the economics of data, and the how data can be used to publish reports, and some doctors are doing it very well right now. Sooner or later everybody will adopt it. It's only when doctors realize the economic benefits that they will start using EMR. I was trying to convince my doctors, and one doctor said that I will not use the EMR because I make my diagnosis by the time the patient walks in and opens my door and walks up to my desk. I've already made my diagnosis. So should I spend the time making the diagnosis, or should I spend the time talking to you bullshit software? So that is the thing. So I mean that is changing at a very fast pace. Of course, voice-based systems, everything is coming up, and we are coming up with all these things because the doctors are not accepting it. The day they accept the economics and the day they realize the economics, they will write also, they will type also, they will do everything to earn that money that is coming on the table through data. Secondly, from a hospital, from a patient perspective, right? From a patient perspective, digital health basically means providing convenience to the patients. Now, whether it is accessing lab reports which 2 years back, accessing records which were 2 years back, booking appointments, talking to the doctor. I mean, today you tell me in large setups, if I have to call any big hospital today and I have to get through a doctor, you want to understand something, I would understand a difference between laparoscopic or open surgery. It could be anything, right? I could have multiple questions around it, but it is so difficult. And I think the way Indian healthcare has grown in the last few years, it is so difficult to navigate the system the way it is right now. It is almost challenging till you have help. So that convenience is going to come for the patients in the coming days. From hospital perspective, from owner's perspective, mark my words, 30% of the healthcare that we are providing today will go away from us. I mean, it will come back to us through aggregators or wherever, but the way patient access, the way the patient acquisition is happening, 30 to 40% will actually go on a digital platform, and we all need to be super ready. And that's why everybody's betting high on these healthcare startups, because you don't need to develop your own systems today. There are so many companies, you just need to pilot it out, right? Get the right partner on board. You need to be future ready, and that will happen. That disruption will happen, and you need scale. You need scale to adopt these technologies. If you don't have scale, you will die down anyways. And lastly, from a revenue perspective, any hospital owner will agree today that if they are earning 100 rupees, there is a potential of, from the same system, without doing anything different, they have a potential of earning 125. That's because of the sheer leakages that are happening right now from a hospital system. We are betting high on that. We are working with third-party players right now. We estimate that leakage in our hospitals to be at least 15-20%. I mean, and that you can leverage technology, customize patient engagement programs, tracking mechanisms. You need to leverage that to get that revenue back into your system. So that was my four-pronged approach on how digital health is going to impact the way we run hospitals, the way we access hospitals, and for doctors in the future.
Thank you so much. Thank you so much, Mr. Kapoor. Now, moving on to my next question, I'll keep this question open to all my speakers. The question is, how does value-based care and digital health fit together? So if I may ask Ms. Banerjee to first provide a perspective to this.
As Mr. Kapoor very correctly said, we will have to realize the fact that, finally, through the mechanism of digital health, we will have to understand the economics of it. When you say the value-based care, if I say that we essentially mean that it's value for money. If we say that, the value of, if we try to consider the value of healthcare delivery system, there are two parts of it. What I feel is, from the patient side, it is definitely economically and practically efficient to opt for a digital health platform to get some of the healthcare delivery systems. I'm not saying that, you know, the digital system of healthcare delivery is going to supplement the traditional way of healthcare delivery system. It cannot, but it is a supporting system which is being, you know, which is being created around. It does fit in. On the other hand, the only challenging part, if I have understood the question correctly, what I find is the cost of these, you know, digital health systems. These are at times pretty expensive. You know, finally, we will have to figure out how this entire healthcare delivery system is going to handle this cost, how it has to be passed on to the patients, how it has to become an integrated part of the healthcare economic, the delivery economics. Was that the question, Momita?
Yes, yes.
Yeah, so it goes hands in hand. I'm sure it goes hands in hand. But as we are at a very nascent stage of digital healthcare delivery system, perhaps we will take a little more time to figure out how to handle the entire economics on one part, and the patients on the other hand will take some more time to realize how it's adding value to their entire service receiving system.
Sure. Yes. Dr. Manivanan, can I have your perspectives on this?
Yeah, see, value-based care, if you see in lean methodologies, they will audit and find what is the non-value added activities, NVAs in the system, actually, okay? If you feel that, say, for example, I'll say, a patient is coming to the hospital to consult a doctor. He comes at 9 o'clock. The doctor comes at 10 o'clock. And he waits for another half an hour. And he consults the doctor for 5 minutes. Okay. Then after that, he goes to the lab, waits for half an hour to take blood, waits for another 1 hour to take the results, then comes back to the doctor. Doctor diagnoses for another 5 minutes. And then he goes back to the pharmacy, gets the medicine, goes home, actually. In the entire 3 hours, only value-added activity is the doctor consultation. Rest of the activities, waiting time or waiting in pharmacy and lab, are non-value-added activities, actually. Okay. So if you want to say value-based care, actually, it is actually a kind of a patient-centric approach. Okay. You have a patient, everything is towards the patient, the patient waiting time or whatever it is. He is ready to pay 200 rupees or 300 rupees for the doctor consultation. He is not paying for waiting, actually. Okay. Digital initiators will eliminate all these wastes in the system. The patient need not wait for 1.5 hours. He could book an appointment. There's a delay in appointment, automatic messages could be sent. You could just come 15 minutes before the appointment. And if possible, he can go back after the consultation, ask the lab to collect from the home and upload the results. And then next day morning, he can, right time, he can do a teleconsultation. Okay. So ideally, within 45 minutes, entire care could be delivered, actually, rather than 3 hours. Actually. So any healthcare operator or any healthcare administrator should ensure that we have to eliminate non-value added activities in the whole process, actually. The same thing applies for a doctor or a nurse, the caregivers. Imagine the caregivers spend a lot of time on non-value added activities. For example, as a doctor, if you ask me, where I add value, when I go see the patient, okay, and of course, look into some investigations, other things, examine him, spend time in auscultating, palpating him and other activities, take the history properly, talk to the family, talk to the patient, and then diagnose it and giving a prescription, actually. But what happens most of the time, the activities which I do is primarily, so I have to search for the lab results. I have to search for, I ask the nurse, what is the lab results? She'll go around, get the lab results or radiology reports. And the proper history taking was not possible. Attender is not there. And see, all these non-value added activities is not adding value to my care, actually. I mean, rather than seeing 10 patients in 1 hour, I'll be seeing 5 patients in 1 hour, actually. Okay. Or I'll be rather spending less time in giving the actual care to the patient. If you see non-value added activity for a nurse in an 8-hour shift, if you really calculate, there are 6 hours of non-value added activities out there. Okay. We did a small calculation, did a study, where we found out that most of the time nurses are running between the rooms and the nursing station. The nurses are attending phone calls. The nurses are attending nurse call system, but most of the nurse call system, if we ask, the calls are for, say, I need a pillow cover, my light is not working, my bathroom is not working, or I need food. These are the calls which nurse call systems will have. And of course, they write a lot of notes, actually. If I eliminate 75% of this, so the nurse will be spending on the bedside at least 6 hours in the 8-hour shift, actually. The time spent on the bedside with the patient is the value-added activities there. Definitely, digital initiatives in various forms can eliminate non-value-added activities. So that's what my opinion is about how value-added care can be enabled by digitalizing the entire care process.
Sure. Mr. Kapoor, if you can put your thoughts into this.
Yeah, so, just building on what Ms. Banerjee and Dr. Manivan said, I mean, when we talk about value-based, care using digital health, digital technologies, I think it boils down to a couple of things, right? For a resource-scarce country like India, it is about using technology for effectively utilizing resources. I mean, how can one doctor cater to double the number of patients? How can one nurse cater to 5 times the number of patients? So that is where the technology is going to help you. And secondly, in future, believe it or not, I mean, technology will make it the care cheaper and convenient for patients. I think those are the 2 aspects, and I think Dr. Manivan has already explained it in greater detail. So it's about efficiency and cost that technology will actually increase the efficiency and bring down the cost.
Yeah, Momita, you can go ahead. Yeah.
Yeah. Have we? Okay. So thank you so much for all your viewpoints. Now moving on to a few questions which we have received while we had our registrations going. So first, I would like to drive my question with Ms. Banerjee. How would you measure efficiency in healthcare setup with reference to digital health?
As we were discussing, Dr. Manivanan very clearly said every steps in the healthcare delivery system, starting from the booking at the ambulatory care setup to the doctor consultation to the inpatient area, where he was very clearly, very nicely mentioned that there are non-value added activity. If we wish to eliminate the non-value added activity, and automatically that will bring in efficiency, and that will happen through a digital system, efficient, meaningful digital system.
Right.
What are we trying to eliminate is very correctly said are the non-value added activities that automatically brings in efficiency. And you can only do that with digital platforms. And what Mr. Kapoor also has very correctly said, that a country like India, where there is already a resource crunch, who is going to solve the problem? A good, efficient, economically affordable digital health platforms.
So true. So moving on to Mr. Kapoor, how can we talk about digital health and not talk about Ayushman Bharat digital mission? So my next question to Mr. Kapoor would be, how can Ayushman Bharat digital mission leverage digital health to enhance reach and affordability? And where are we currently standing with it? And how can we move ahead from here? Your thoughts and viewpoints on this, sir.
The Ayushman is definitely a step in the right direction by the Indian government. Uh, there can't be a healthcare system of 150 crores people where majority of them bank upon paying out of pocket for healthcare expenses. There is no way we can improve healthcare outcomes or the healthcare burden on people till we go towards universal coverage. Now it's Ayushman is in a very nascent stage right now. It's a step in the right direction. It's going to evolve over time. More and more players are going to adopt. The government is going to evolve their views on it, and uh, you know there will be there will be a common point between the private players and the Ayushman mission going forward. And on top of that, the government is trying to build a national database. I mean, something like what NHA has done and everything. Uh, all your records, everything, all in one place, one data, and that is going to help everybody and everyone across the country. I mean, we need to get on a platform where all our database is accessible to each and all of us, irrespective of which hospital or which lab or which pharmacy we go to. It has to be in one place. That is very important, and so that is on the digital part. And secondly, without universal coverage, we cannot solve India's affordability and accessibility problem either. For healthcare.
Absolutely. Thank you so much. Now I would move on to Dr. Manivannan. Apart from Ayushman Bharat Digital Mission, how else do you feel that the government can support the sector and the consumers for adopting a wider scale in implementing digital health across the ecosystem?
One thing is, of course, the government did an amazing job during COVID pandemic, removing all the unnecessary restrictions in telemedicine. Actually, okay. I've been part of this telemedicine society for the past 15 years or so. We've been talking the same thing when nothing was happening, actually. In fact, Apollo has done an amazing job in setting up centers and all those things, but nothing fruitful has been happening to most of the players, actually. And it removed all the restrictions, actually. And telemedicine became amazing. Adoption was very good. A lot of new companies have come. Of course, the adoption decreased after pandemic, but still it's sustaining and slowly it will gain, actually. It will gain traction. So we need to understand that it takes time. I say, if you take our UPI payment system, it's the best in the world, actually. Best in the world. My friend who came from UK last week, after 2 years, he was not here in India for the last 2 years. He suddenly came. He went to a small vendor and he said, I don't have a change. So do you have a Paytm or something else? He said, Paytm is there. And after he immediately paid the 50 rupees paid. And there was a sound coming also from the system. He was so amazed. He then recorded, paid once again and recorded everything. He said, what's happening in India? I said, man, India has developed so much in the last 2 years, actually. But the reason for that, we should all understand that the UPI payment system is a layer built over the core banking system. Core banking system has been there in India for the past 20 years, actually. So all these UPI payment system is a layer built over that, and that has enabled the digital transactions to be transmitted across everyone. Whereas in healthcare, if you see, most of the private hospitals or big hospitals are also not digitally enabled. The records are not there digitally stored, actually. There is no interface. There is no HL7 interface or whatever it is. Interoperability is not there, actually. So it may take a long time. As Kapoor said very clearly that it is in the right direction, but it is in a very nascent stage. I feel sincerely that it will take 10 years for us to get the UPI kind of adoption or growth, actually, where a common man can just click his app and get an access to his records in the last. When first visit could be in a government hospital, the second visit could be in a private hospital, third visit could be a tertiary care hospital. That will take at least 10 years. But slow and steady. No country has done this great. And EMR adoption in digital adoption in US, a lot of money was spent during Obama period, but hardly much of an outcome. NHS is good in UK when compared to other countries where the last 40, 50 years of records have been digitalized actually. So it will take a longer time, but the growth path will be very fast. Growth curve will be very fast actually. So telemedicine is a very good this thing. It doesn't require any past record. Now we use all WhatsApp and other kind of a communication, send the records and all those things. That is one thing. Another thing is when we are moving digitally, the government should ensure that all the security features are implemented in the right way. Actually, if there is a leak in all the digital health records, then that's going to be a big problem. Actually, leaking of other data is also dangerous, but the leaking of digital health records is very dangerous. So we need to, right from beginning, we need to start building a good, secure systems around all these digital health initiatives. If we do that, then that will go in the regulated market. Otherwise, people will be taken for a ride with all these scamsters and other things. So we need to be, the government should ensure that data security systems need not be as rigid as GDPR in Europe. GDPR in Europe is very rigid. So, but at least a diluted version of GDPR, like what we have done in NABH, actually, we had the diluted version of JCA's NABH and our entry-level NABH for tier 2 towns, actually. That's a good, I mean, everyone talks about quality, even tier 2 or tier 3 town nowadays. So a diluted version of GDPR for data security is something which the government should bring in. Realistic, actually. They shouldn't be over-ambitious. They should understand that it will take 10 years at least for digital health to be really adding value to every customer, actually. So that's what my take is, actually. And telemedicine is a beautiful, amazing initiative. And I think that will grow significantly. And from over a period of time, it will come back. Say, well, like banking, core banking came first, UPA came second. Whereas in health, actually, telemedicine came first, and then back-end integration with all the data systems will happen. That's all my take, Mamata.
Thank you so much. Thank you so much. Now, moving on to Ms. Banerjee once again. So as we have all spoken that we are still in the developing phase of digital health, we are in a very nascent stage of it. So what is the primary role being a private healthcare sector, or the role that a private sector can play in developing digital health of the nation? Maybe in terms of adaptability, in terms of facing the challenges to it, primarily in terms of adaptability?
See, the challenge is not private or public. The role is essentially the entire healthcare delivery system. If we are moving digitally, it has to happen jointly. It cannot be that private sector would be doing something and the public sector would be doing something. It has to happen in a holistic way. So typically what I feel, which Dr. Manivanan was saying very correctly, that the bigger hospitals are still not digitally sound. So what we need to essentially bring in as a private sector player is the sensitivity of this. The system has to be sensitive enough towards adopting a patient-centric digital healthcare delivery system. That's where we probably will have to start sensitizing the starting from the patients to the doctors to the delivery system, the support team, the clinical team, the paramedical team. The entire system has to get sensitized. That is the bigger role. What I feel strongly, that unless and until we are strongly sensitizing the entire system, if the bigger hospitals are not taking the way forward towards this digital path, we will not move. Again, I'm telling you, it's not private versus public. It's the entire delivery system, healthcare delivery system has to move towards that.
Yes, true, so true. Moving on to Mr. Kapoor, we'll speak a little bit about the insurance players and their role that they play in optimizing the operational efficiency in a healthcare setup. So how would you look into it from the perspective of digitalization?
Insurance from a digital perspective.
Digital perspective.
So, whether it's Ayushman or whether it's insurance, they all care can only be optimized in a country like ours, and that's true for any other country, right? Whether you look at the UK, whether you look at Canada, they talk about best access, best affordable healthcare and everything. because people are insured, people are not paying from their pocket, so people don't accept suboptimal care. Today, there is a majority of the problem, and we operate in tier 2. The biggest issue is that because 70% people are still paying out of pocket, that they end up going to suboptimal facilities, suboptimal doctors for very serious conditions, and then their cases get spoiled, and then only when they move to larger setups like ours, or many other in the country, and by then they've exhausted their funds and everything. So that way, the biggest thing the insurance can do, that people will get the best care immediately, right? And there'll be no pressure on quality when people are paying through, when people are insured. Right now, most of the small mom and pop centers, 30, 40 beds that are operating across the country, who are delivering maybe 80% of the care today, uh, at some level, there is a compromise on quality or protocols, because of they want to keep the cost down, because they want to be competitive, right? I mean, somebody is doing a lab colleague for 100 rupees, somebody wants to do it at 70 rupees to attract more patients. I mean, so that component has to go away. And when everybody's insured, right, the insurance companies can then start playing on the fact that, like it happens in other countries, that with digital health, patient outcomes will start getting tracked. Hospital wise patient outcomes will start getting tracked, and then hospitals can, and insurance players can negotiate with each other how much they deserve to get in for a particular surgery, and that will happen. And that will surely happen. For example, if it's a 99% patient outcome for particular X, so the insurance company would be willing to give you a higher price, because they know there'll be less hospital errors after that, there'll be less going back to the hospital after that, there'll be less hospital infections coming out of it. So that digital health is going to play a very, very important role when it'll all bring together the patient outcomes and the insurance and the providers and the patients, everything on one platform. It is going to be a game changer. And even pre and post COVID, it was so difficult to convince people to buy health insurance. People were buying life insurance. They really cared about their families, what happened to it after they were not there. But nobody really seemed to care about buying health insurance. I mean, I had to convince so many of my friends and their parents to buy health insurance. It just seemed like talking to a dead wall. It didn't make sense. And post-pandemic, suddenly it's made so much sense. I mean, tier 2 city like ours, we have gone up. We've gone up from 7% revenues from TPA to now almost 23% revenues from TPA in a span of 2 years. Phenomenal jump. And I'm sure most of the hospital players have seen that jump today.
Yeah.
Very true.
So your take on this, Dr. Manivannan, and also Ms. Banerjee? This is a very interesting topic that Mr. Kapoor has picked up.
Yeah, basically, see, insurance, as Kapoor said, thanks to, sorry, I shouldn't say that, because of COVID, the digital health, telemedicine has improved well, and insurance also is very good. See, today, patient, we also have most of our hospitals in tier 2 town. So there's a sudden surge in insured patients, which is good for us, actually. But see, one thing is, we all know that insurance after some time will tighten the pricings and all those things. Unless we are operationally efficient by using digital tools and other things, say it's very difficult to survive in insurance world, actually. So we need to, one or two things which the insurance company need to do, that is, say, they should force the hospitals to have interoperable ERP systems, actually. Basically, where data can be transferred from them to the other systems easily. Flow of data can be easy. So currently, a lot of paperwork is being happening in the claim system, and that delays the payment and your capital erosions and all those things. That capital is there, actually. So they should increase the digital communications between the hospital and the insurance companies. For example, I still remember way back in 2009 when we introduced the Chief Minister Insurance Scheme in Tamil Nadu. The Star Health Insurance introduced the ICD coding. They said that every discharge somebody should have the ICD coding. So ICD coding, having an ICD coding saves a lot of manual work for the insurance people, actually. And if you have more digital data being transferred to the insurance company, the insurance company can actually deduct any frauds easily, actually. Because why premiums and other things are higher? Because a lot of unethical people are getting paid for the procedures which they have not done. If you have the digital transmission of data, then the frauds can be deducted easily. One thing probably in a short term, which insurance company can do is, if they are going to pay the doctors 30% more for a teleconsultation, I think that will be a big jump in teleconsultation. So that's what my take is.
Ms. Banerjee, over to you.
Yeah, I was very correctly, Mr. Kapoor has picked up the point that insurance through digital health can actually move the focus from this quantity to quality. Every time when we go and get into the negotiation with the insurance company, it's the negotiation on price. And the price is key, he's very correctly said that, I want to give you the lab query at 70 rupees and I will say I don't want to work with below 100 rupees, but it actually should be tagged on the outcome. The moment this happens, and it's possible, the moment the digital communication happens between the hospital and the insurance company on the outcome, it's definitely possible. A hospital which delivers the best of care gets the best of rates, because then the rate of hospitalization is raised, the patient stays shorter, so the insurance outgo is less. So this is the place where insurance companies, I'm sure they will come into. This is how it happens across the globe. And I'm sure that would be a very, very important area for the insurance companies to, use the digital platforms.
So thank you so much, everybody, for all my eminent panelists for sharing all your viewpoints on various topics. So we spoke of impact of digital health in various aspects of our healthcare ecosystem, including insurance. We concluded with that. It was wonderful to have you all here, Dr. Manivannan, Ms. Banerjee, Mr. Kapoor. If there's any question that we have missed out, we would definitely get back to y'all and we would want them to be answered by y'all. I would like to thank all of you on behalf of the entire Nathealth Secretariat. We would like to thank all the participants who joined the session and all who have been watching the session live on our social media. We would like to thank our PR team, Avian, and our communications partner, Valuebased, for their constant support. In case we were unable to answer any questions today, we will always get back to you all, and our speakers would be very helpful to get those answers done up, and we will get back to you on that. We will be back again with another set of panelists throwing light on some other aspects in our upcoming sessions. We will be posting this video of the session on our Facebook and YouTube channel for all of you all to like and share it amongst your community. And please don't forget to subscribe our channels. So I would really want to know how you all liked the session and how you all have benefited and wanted to know more of it. So I would like to take a leave from this. So take care, bye-bye, and see you soon.